every data has shown that when you have independent doctors in private practices, they deliver better care. Literally, their outcome is better. The cost of their delivery is lower than bigger entities. That's just the way it is. So for me, when I look back and say, well, if my drive, if my inner why is democratizing healthcare, and that means making things affordable, accessible, and available, those are the 3 A's when it comes to democratizing healthcare, then independent doctors and independent medical practices is a crucial piece of my mission. Certainly, there's nothing wrong. We all train in big academic centers. They exist for a reason. And many of us may feel more comfortable working for a big corporation or a bigger group or a hospital system. Nothing wrong with that. But the option should always be there that if we said, you know what, I want to start my own private practice. And that process should be as easy as possible.
Welcome to Startup Physicians. Please like and follow our show to join our community of physicians who are reimagining healthcare delivery. Hi, everyone. Welcome back to the Startup Physicians podcast. This is your host, Dr. Alison Curfman, and I am joined today by Dr. Michael Fang, who is a geriatrician, but a serial entrepreneur and startup co-founder. Hi, Michael. Thanks for joining me today.
Hey, Alison. Great to be here.
So we first connected, I think, at a conference. I think we were both judging a pitch competition, which was great. And I was so impressed by the current startup you're building and the previous work you've done, and obviously found a lot in common. And I'd love if you could share with us a little bit about your clinical training background and how you got started as an entrepreneur.
Well, thank you, Alison. And remember, you were the judge, I was the MC. So I'm not sure if you were just entertained by my crowd skills or anything, but I really appreciate you being a judge on that. And yes, we certainly share a lot in common. But thank you for having me on your show. And my background is I'm an internal medicine, geriatric medicine doctor. I always tell folks that ever since I was 8, I knew I wanted to be a doctor. By the age of 12, I knew I wanted to take care of elderly people. So that's exactly what I did. So when folks ask like, well, did you knew you were going to be an entrepreneur or go into, the answer is no. My major in college was cell molecular biology. That's about as medicine as it gets, right? I didn't take a year off to go do something else. In med school, I went straight from college into med school, straight from med school into residency, straight from residency into fellowship. Like I did not at all during those times ever thought I would be building companies or not being anything but a doctor, right? And quite frankly, I was so excited to be a geriatrician when I did graduate, become a geriatrician. I thought I had achieved my life goal, right? So it's like the astronaut that made it into space. And unfortunately, once you make it into space, you realize that space is actually really scary. Things are going to be breaking down and everything's rattling, right? So that's what I realized as I started practicing, that all the things that we were sheltered from when we were training, we didn't see in the business of medicine, in the real care of the patient. And that's when, quite frankly, was when I became interested in figuring out like, okay, well, I'm really good with my clinical skills. I'm really comfortable with me as a doctor skill. But there are issues here that is beyond how good I am on a one-on-one in a room with a patient that I need to understand better. And that's when I became more interested in the business aspect of healthcare. And from there, started to look for solutions towards those problems that I was experiencing.
I think it often starts with an awareness of the problems. And I think maybe when we're students or still in training, we are so heads down in our training and development that we see the problems, but we maybe are more cognizant that, this is part of the system that we're trying to learn. And we don't necessarily know how to fix those problems, or maybe we do. Sometimes we see something that, we're seeing it with fresh eyes and being like, why in the world would we do it that way? Right. But what was the first problem that you were drawn to create a solution for?
So interestingly, this was when I was practicing at Indiana University Health System. And this was when EHR was just starting to be implemented, but quite frankly, it wasn't really a humming piece of tool. And frankly, most of us still hate it right now. But back then, it was definitely not working very well. And I was, I was a geriatrician and I was working in a community hospital, right? So It was a small community, farming community. So we always had a lot of patients that were readmitted. And what happened was, as a geriatrician, our focus often is around the social factor, right? We ask a lot more like, do you have stairs at home, right? Like, are you able to cook for yourself? If you're an older person, do you have caretakers? Is your children like right next door? Are they like 70 miles away, right? On another farm, right? So I asked a lot of social history. And what was funny was I started tracking those social history on a Excel spreadsheet. And at some point, I was able to predict with almost a 90% accuracy when a patient was going to be readmitted, not based on their meds, not based on their follow-up with their doctors, but based on when their caretaker was not going to be home for more than 24 hours. Because it correlated to when your caretaker is not home. Again, we were in a farming community, lower access to healthy food, elderly people who can't cook for themselves. So what happens? TV dinner, microwave, right? Canned foods, lots of salt, lots of processed things in there. They tend to have heart failure, renal insufficiency. So what happens in 24 hours after they had 3 meals of high salt? Water retention, right? What happens after that? ER, right? So I was able to predict literally like, and whenever their caretaker was going to be away for more than 24 hours, and if they didn't have any prep food, they would be back in our ER with heart failure or fluid retention and so forth, right? And that was what's contributing to our CHF readmission failure rate. So once I figured that out, I started coordinating with the case managers to make sure that on those 24 hours, we let the family know, like, hey, try to prep the meals in advance, try to maybe increase the Lasix by a little bit the day before that, just to kind of get them to a little drier state. And that lowered the hospital readmission. And this was basically social determinants of health, right? But this was 15 years ago when that wasn't a term, right? So I took a spreadsheet and then later on met a couple of gentlemen who were interested in building a software around that. We turned that into a software. Again, though, in the US, people had no idea, and there was no reimbursement around social determinants of health as an outcome, right? But my two partners said, well, actually, England, with their single payer system, knew exactly what to do with data like that. So we ended up taking the company to UK. I couldn't go with them because I was still practicing in the US. I had some shares as a co-founder, and I have quite a bit of shares as a co-founder, but they took the company, relocated to UK. Long story short is that company ended up servicing 7 million patients on social determinants of health data, helping the NHS, their National Health Service, budget what they need to have for patients to take care of home care or food delivery or medication delivery. It's still alive today, but it's been in the European countries quite a bit. And now that we know about social determinants of health, that company is going to be making its way back to the US.
It's like a boomerang.
Yes, we tend to be innovators in this country, and we tend to have a slower uptake on regulations to support that innovation.
That's really interesting. And what strikes me about it is that what you're describing is not rocket science, right? There's nothing about it that's like, oh man, how innovative. Like, give these people more support when they're all by themselves eating bad food with their heart filled. Like, these are things that probably any of us could have noticed or seen patterns. We see patterns all the time. There's all these things about like, oh, well, like all of these patients that have this end up in the ER for this. Like, I mean, I'm an emergency physician. I mean, we have so much pattern recognition, but we don't usually have the power or capability, or so we think, to solve that. And I remember actually during fellowship, I sat down with a mentor in my program about what I wanted to do my research on. And I said, like, I wanted to do it on social determinants of health, which again, that was also, more than 10 years ago. And he said, Alison, you're never going to be able to solve that problem. Because I was like, I mean, all these people end up in the ER that what they really need is another setting of care or better access to care. And I was thinking about doing like a survey or something around like what lands people in the ER, what was missing from their care before. And he was like, you're gonna burn out. If this is part of practicing emergency medicine, you will burn out if you feel like you need to change it, because you just need to accept it. You need to accept that this is part of practicing emergency medicine, and you need to put your head down and pick a disease and get to be an expert on it and publish and work your way up the academic ladder. And I was like, oh, okay. So I like totally abandoned that idea. I became a international expert on fusobacteria bacteremia, which is Lemire's disease, which I've never seen, but I've written papers on, and it, was not meaningful work in my opinion. But then I kind of returned back to this concept of like, how do we keep people out of the ER? But my point is that like the things you were seeing, the patterns you were recognizing, and the problems that you felt like needed to be solved, they aren't rocket science. Most of us have ideas about these things in our own practice that we see every day. And you're talking about starting an Excel sheet, and that was your starting point. How did you find these partners that wanted to make it into a tech platform?
Yeah, so I think to just kind of piggyback on what you shared there is, yes, healthcare, especially for us physicians who are literally in the midst of it, you can throw a stone in any direction and hit $1 billion problem, right? Like there's always going to be a lot of diabetics, a lot of obesity, a lot of cancer, pick a problem, and it's $1 billion problem with 1 billion people behind it, right? Like as an issue. So that's the good news, is that if you're looking for a problem to solve, to work to kind of learn to exercise your innovation mind, you're in the midst of it. You're going to find plenty of issues to solve. And yes, it doesn't take a lot for you to figure out the problem. We've been equipped with that skill set through our training. We're extremely good at data gathering. We're extremely good at processing large volumes of random information and trying to see a pattern behind it. We're very good at experimentation, like fast, like what they call Lean Six Sigma or lean development. Like we do that all in our brain, right? Like we go through and test this antibiotic. Nope, not that one. Oh, IV fluid, not too much. Turn it down, right? Like we do that very, very quickly already as part of our training. In fact, I would tell most physicians that to make it to where you are, you've been selected based on those skills. If you didn't have those skills, you didn't make it. Right? If you couldn't process information quickly, if you couldn't tolerate large volumes of information, I mean, you remember residency and like you learned a different skill set every month, right? Like 1 month, or you med school, 1 month you were delivering babies, the next month you're doing plastic surgery and trying to close wounds, and the next month you're trying to learn how to do colonoscopy, right? Like or the next month after that you were managing dialysis, and the month after that you were an event in ICU, right? We learn very, very fast. So if you couldn't learn quickly and you couldn't tolerate massive amounts of information and you couldn't recognize patterns and figure out, A/B test our assessment and plan, right? Like if you couldn't do that, you didn't make it as a physician. And those are the same skill sets that make successful entrepreneurs, very literally. Okay. But going back to your question about like, well, so how do you find the folks? So that's the other important thing is that, yes, you are very vertically trained, right, as a physician in that skill set. You don't need to go learn other skill sets because that's the one skill set that other people can have. I always say, like, MD is one of the few degrees you can't get online still, right? So
True.
You have a skill set that nobody else can actually get unless they literally went through med school and residency and fellowship and training. So a lot of doctors might be like, oh, Mike, you did this on Excel spreadsheet, but then did you build the software? I'm like, no.
Yeah. Did you know how to code it? And it's like, no, there's a million people that can code it.
Yeah. And they're like, oh, did you go get a master's in informatics? I'm like, I as soon as I graduated, we had our first child. I was busy working. I did not go get a master's in informatics. There was no time. I still had a debt. I wasn't going to add another master's, 6-figure debt.
Yeah.
To that. Right. So the other thing that I would say to kind of that we're also good as physicians, right? And again, recognize this is that we as physicians don't try to pretend we know everything. And in fact, I know sometimes people accuse us of that, but actually we don't. So think about in your specialty, if you like, especially for ER, right? Like, how to call for consults, right? You're not going to
know what you know and know what you don't know.
Exactly. Like half the time I tell doctors, like, what were we trained in? We weren't trained to recognize diseases. We're just trained to recognize what's normal, right? Like, and then when it's not normal, we go, okay, well, that's no longer normal. Something's going on. Now, we may not know what that is, but we know how to seek answers. And part of that is pulling in other experts, right? So same thing when I started entrepreneurship, or when I started to want to build that software, it wasn't because I was like, I want to build the software. It was like, well, I don't know how to build a software, but I know how to look for help. So this is where I went on LinkedIn. And yes, instead of going to a medical conference, I went to a tech conference. Now I felt very out of water. One of my first tech conference. Looked around, I couldn't recognize anybody because obviously no doctors ever really show up to those, right? So, but you just use your people skills, and just make connections, right? And once I made some connections from a couple of conferences, they were able to introduce me to other developers, and that's where eventually I found my two partners who did have software development skill, and and together we were able to build this platform that ended up being, like I said, in England.
That's so cool. And it's also interesting that it found its roots overseas and then now is coming back to the US. I think it's interesting how sometimes other countries' payment systems or payer systems make them more amenable to certain models. I know back when I was doing the initial complex peds work, I was also working with a group in Australia, and it was like very easy to implement there because of their single payer system. But it was incredibly challenging to implement here until I had the support of a firm and the capital to take full risk. But so that was must have been a really interesting and cool experience founding a company that then really took off overseas. What did you do after that?
I was still practicing full time. So I actually practiced full time as a geriatrician, either in large hospital systems or in my own private practice group until literally the middle of pandemic. So one thing I'll tell doctors when they say like, well, do you have to give up clinical practice to go do this? I'm like, well, I didn't, right? And again, if you found a problem and you know how to distill the problem down its root cause analysis, right? You find out the root cause and you say, well, this is what would be the solution to solve this root cause. Then you go gather the team, right? To help you build the solution towards that. So no, you don't have to give up a full-time clinical practice. I didn't. And again, I was still trying to be a good husband and good father at the same time, right? And doing all that. So I was practicing full-time. And I tell a lot of physicians, like, in fact, having that stable job, that stable salary as a physician allows you to be a little bit more brave as an entrepreneur, right? You and I both know, Alison, like sometimes when you're a startup, you're pitching for $10,000. And I'm like, we could make $10,000 just by doing 7 night shifts, right? Like, so you actually have the ability through your career to fund little things until you figure out what it is you want to do, or realize that, you know what, I really don't want to do this. Also good, right? But you have the ability through your clinical salary to experiment with building little things, which
you will always be employable as a doctor.
Exactly. And you don't have to waste your time pitching for small amounts of money, right? Like you have that capital. I also want to remind our colleagues who are listening that you have other doctor friends, right? So some of my earlier startups, if I created a solution, some of my physician friends are like, I'll put in $5,000 on that. So you could raise money from your own network and that's actually really powerful. I know a lot of startup founders who are not from the medical world, right, that have to raise money, and you could literally spend 50% of your time as an entrepreneur just trying to find money, and that's really right. That's where they burn out and they feel disheartened and so forth. So as a physician, you actually get a quick pass on that on the early phase of your career. But I was still practicing. But once I had a taste of the entrepreneur world, I was kind of hooked. In that I found my niche, right? So I wasn't like a researcher, right? I did some research. I thought about a PhD, and I realized I wasn't really that smart enough or patient enough to go through years of research to figure something out, right? I also realized that I do like teams. I like networking with people, right? Like I didn't want to. I didn't want to be. So like I said, internal medicine. So I'm not radiologist where I'm sitting in a room and just reading through like cases by myself, right? Like, and props to the doctors who do that, right? But I realized that I really liked interacting with folks to solve a problem. So entrepreneurship offered an additional outlet for my energy as a doctor. Yes, during the day I was solving patient problems, but in the evenings I was able to solve more like healthcare problems and dealing with a different set of folks, which was very re-energizing. In fact, I think I didn't burn out because of that, right? So during the daytime, yes, I'm interacting with all the clinical folks, nurses, doctors, other things like that. But at night, I get to work with developers. I get to work with software designers. I get to work with, like policy makers. I get to work with lawyers, right? So they're interacting with those folks. I realized gave me a lot of. I get to learn off of them, and it was new stuff, different from what I heard more of the time during the day, and that allowed me to have extra energy and extra kind of passion for what I'm trying to solve. So as you're exploring, right, as a physician, if you're thinking about entrepreneurship and you find that kind of interaction with other types of experts in other industries really energizes you, then I would say, yeah, then that one will help you keep going as a doctor, and two will help you learn more and help you be not burn out as quickly, right, as a physician. I'll just add this. Oh yeah, sorry, go ahead.
Oh, I was just going to say, I think it adds a little bit of just interest to your day to day when you're working on things that aren't always, the same. I mean, not that things are always the same in medicine, but there are, you get to a point after you're practicing for 10 years or so that you're seeing a lot of the same stuff. You're dealing with a lot of the same problems, and you're maybe interested in doing something that is not so predictable.
Yeah. And I think the other thing I'll just kind of let doctors know, again, I really, if you ask me, I always say, like, I really feel every doctor, if you graduated, you have all the right skill sets and personality to be a very successful entrepreneur. So I talked about data and organization, but there's another very, very key thing that we physicians have that really is a secret ingredient to successful entrepreneurship, and that is our level of curiosity. Now, yes, you're right. As we went through our career, and we become more, kind of buried under the reality of our career. Like your mentor who said, oh, don't worry about that, you burn out, right? We even have our own doctors, our own coaches, our own physicians, our own family sometimes, right? That says, oh, don't think about that. But if you think back to when you wanted to be a doctor in med school, you were so excited about the things you could learn. You were excited about getting your hands on that patient. You were excited. Like, we fought to do central lines, right? Like, when maybe there was one student that's like, I really don't want to touch this, but they would fight for some other procedures that they want to do, right? Like, we fought to do because we were naturally curious. And again, if you weren't naturally curious, you wouldn't make it as a physician, right? So what I would say is again, after years, we may have been beaten down to lose that curiosity a little bit, or we may have burned out a little bit and lost that curiosity. But I would say revitalize that. There are a lot of things that you don't even have to spend time like I did to build a spreadsheet and find. Like, have you ever been curious, like, just be more curious about your work, right? So for example, when you give a medication, are you curious about how that medication got into the hospital? Like, how was it bought? Like, where did it come from, right? If you had this or if someone says, oh, we need to do this, you need to write it like this so we can get a higher reimbursement. Have you ever been curious as to why that reimbursement is this way, right? Other than just like, well, you got to be more specific. Oh man, like, we can complain about it, or you can be really curious and say, well, why is it that if I wrote my note this way, that you would get better reimbursement? How was that determined? Which payer makes that decision? And how would they know, right? Like, if I wrote this, how would they know? How do they keep track of it, right? And there's a lot of things, if you revitalize your curiosity about your own work environment, you will start to see opportunities to learn everywhere. And this is where I would say it's possible for you to even talk to like folks, like even if you're a big hospital system. I mean, my IT team hated me because I was always down there like, hey, how come we can't have this button over here? And they don't just go, oh, because Epic doesn't let. I just go, no, but why not? Right? Like, and they would have to explain like, well, they use this software to code it this way, so it takes them 4 months if they want to recode it. I'm like, oh, okay. Then what? Right? So, or if I put this data over here, why does it take 4 weeks before?
It's like having a 3-year-old following you around, going, why?
Yeah, why is that? Like, why is that? And I think if you can revitalize that, you will find more joy in the environment that you're in, right? And you'll also start to see more opportunities, perhaps an opportunity where you do want to invest a little bit more of your time and effort and even money to put together a potential solution and a potential business right behind all of that.
I think that the way physicians tend to get curious about things, I think they tend to have like a little bit of a chip on their shoulder about billing and coding and documentation and supplies and all that stuff. It's like not really like, ooh, this is so interesting. But the reason it gets interesting and why people get really curious about it is when it creates some sort of a problem that affects their patients and they start tracing it backwards or tracing it down that like, oh, well, because this happened, this happens. And oh, because this is the situation, like this patient is not getting X, Y, or Z. And how do I overcome this? How do I solve this problem for them? And I think that those are the things that really motivate us. Like I've never been like, ooh, billing and coding. That's so interesting. But then as soon as you get into, value-based contracting and we, for us to be able to provide this amazing service for these high needs kids, we really have to understand the billing codes or, something like that. That then it becomes a problem you're trying to solve that has like a reason behind it, which I think really motivates a lot of physicians. I want to make sure to leave a couple minutes to talk about what you've been building most recently. Can you tell us a little bit about Rise?
Yeah. So if I had to look back in my life and say what has been the driving factor for me as a physician, and then later on as an entrepreneur is towards democratization of healthcare, or that's three, I guess, democratizing healthcare. That really is what I wanted to do, right? So when I got into using data is to try to figure out, well, using data, where can I focus, right, our resources to many folks. I also created a platform that during COVID, where we had 5 nurse practitioners evaluate 1.7 million cases of infection over the course of 2 years, right? So how do we use technology to allow us to be more efficient, to augment what we do, right? Now, after my last company and after the pandemic, I really noticed that a lot of physicians were, like you said, burning out, right? And we also hear a lot of these things like, private, like the individual independent doctor is, or independent practices are dying, and they're all being bought up by private equities and hospitals, which, by the way, I would tell you, that's because there's a financial reason behind that, not because that's the natural path of why they would be here, right? So there was a financial reason of that. We won't go into that today, but there's absolutely every data has shown that when you have independent doctors in private practices, they deliver better care. Literally, their outcome is better. Okay, the cost of their delivery is lower than bigger entities, right? That's just the way it is. So for me, when I look back and say, well, if my drive, if my inner why is democratizing healthcare, and that means making things affordable, accessible, and available. Those are the 3 A's when it comes to democratizing healthcare. Then independent doctors and independent medical practices is a crucial piece of my mission, right? And I want to, certainly there's nothing wrong. We all train in big academic centers. They exist for a reason. And many of us may feel more comfortable working for a big corporation or a bigger group or a hospital system. Nothing wrong with that. But the option should always be there that if we said, you know what, I practiced for a big corporate for 10 years before I go, you know what, I want to start my own private practice. And that process should be as easy as possible, right? So that's when I founded Rise, because I said, well, to what we've been discussed, a lot of times when we've been practicing in large healthcare systems, we don't really understand how to build our own business, right? So we, as you are coming out to build your own practice, you might realize, I don't really know much about billing, actually. In fact, I don't even know much about accounting, or how do I get better health insurance for our employees. And that was actually where Rise started. It was me talking to a lot of independent doctors. And we all said, you know what, as small business owners, we have really crappy health plans for ourselves, right? And we're the most medically educated professionals in the country. And we don't try to use the ER, right? We recognize our symptoms. We probably self-medicate more than we should, right? Around things. So we're not the biggest users of health plans, but yet we have some of the most expensive health plans. Not because we're high-risk patients, but because we are small businesses, right? This is where the curiosity of learning why things are. Like, why is it that we have the most expensive health insurance when hospitals have the cheaper health insurance? It's because of the size of your business. So we founded Rise so that we can create our own health plan for independent doctors in a way that other industries have, for example, as independent restaurant owners or as a trucking company, right? They band together and created their own health plans as a profession. And when I looked around, I didn't see that for physicians. And that's where Rise came out of, was the desire to at least take care of one thing, right? Like just one thing. How can I make taking care of ourselves, our families, and our employees in terms of our own health insurance make that affordable, and make that available for small independent doctors.
That's incredible. And for those of you who are listening, it's risehealth.com, right? RYZE health.com.
That's right.
And I know it's growing really quickly. And I know that you and I both share this vision and mission of really supporting other physicians. I think that the work that you've done so far has been really inspiring. And I'm sure that the ability to provide better access to healthcare for even some of our own is a really incredible mission. And I think that your journey has been very interesting. I think it's inspiring to people who maybe haven't done a lot of, their own tech development or MBA or other things, that to recognize that the problems that you see every day can be solved by us. We can be part of the solution. I want to share that, one of my goals is to really create a lot of pathways for physicians to be able to enter this space as either advisors or consultants or founders through this podcast and other resources. So I would highly encourage anyone who's interested in developing more of these skills to check out startupphysicians.com. But altogether, Michael, I just really want to thank you for joining me today and sharing your story.
Thank you for having me. Yeah, thank you so much. It's been a pleasure, and very inspired by you as well, Alison. I always tell folks, I wish I had a mentor like you, or the program that you offered, right, to teach doctors how to even start in all of this. Back then, I just stumbled through things. So I think it's wonderful you have that program. And yeah, I would really encourage other physicians to check out your program as well, because it saves them a lot of the trial and errors that I had to go through. But thank you again for having me.
Thank you so much. All right, guys, see you next time.
Thank you for listening to Startup Physicians. Don't forget to like, follow, and share.